Hello everyone, welcome back to Chinmoy's Biology channel. So today we are here with the third part of reproductive health, that is infertility. I think you have gone through the previous episodes where I have taught about the contraceptive methods as well as the sexually transmitted diseases, how the medical termination of pregnancy is done and all. So if you have not yet gone through that, I am putting the link in the I box above as well as in the description box below. Now, today we are going to start with a very important topic of reproductive health, that is infertility. So, what are its causes and how can we combat with infertility? We are going to discuss about that. So, stay tuned throughout the full episode and please don't skip in the middle so that as I'll be teaching many important topics in the middle as well, you will miss those. So, let's get started. So, what is infertility? Infertility actually it affects millions of people throughout the world, and it has an impact on both the families and communities. So, it estimates suggest that approximately 1 in every 6 people of the reproductive age worldwide experience infertility in their lifetime. So, this infertility means that they are unable to conceive a child. So in male reproductive system, infertility is most commonly caused by the problems in the ejection of the semen, absence of low levels of sperm, and abnormal shape or morphology, as well as the motility of the sperm is also less in some cases. So in female reproductive system, infertility may be caused by a range of abnormalities of the ovaries, of the uterus, of the fallopian tubes, and obviously the hormonal system, that is the endocrine system, also may have several problems which will cause to infertility among others, right? So infertility, it can be primary, it can be secondary. Primary infertility is actually when a pregnancy has never been achieved by a person because he or she, after having unprotected sexual intercourse for over 12 months, they are unable to conceive or have a child. Okay, and secondary infertility is what? It is at least one prior pregnancy has been achieved, but after that they are unable to achieve pregnancy for the second time. If they are planning for the second child, so after a certain period of time they are unable to achieve that target, right? So that is the secondary infertility which is we are discussing about. Now fertility care is very important when we are telling about reproductive health. So it encompasses the prevention, diagnosis and treatment of the infertility. Equal and equitable access to fertility care remains a challenge in most of the countries, particularly in low and middle income countries. Fertility care is rarely prioritized in national universal health coverage benefit packages. So this is it is very rare that national universal health is covering this fertility under their benefit health packages and all. It is a part which is neglected, but it should not be neglected as it is affecting millions of people and families and communities throughout the world. And we are telling that it is either the male system is not working properly or the female system. So either of the system can work, have problems, and they should take care of that so that they can conceive in a normal way. And if it is not happening, care should be taken. It medical practices should be there to combat this infertility, right? So we will go through several applied techniques. So there are several techniques, assisted reproductive techniques, which are there for combating this infertility, and we will be discussing that in the next class. So today let us see what we are having in store. So why addressing infertility is important? It is very important because every human has a right to the enjoyment of the highest attainable standard of physical and mental health. Okay, so they should attain a physical status where their physical health as well as their mental health is good. Okay, so infertility can negate the realization of essential human rights. Now, addressing infertility can also mitigate gender inequalities. So, although both men and women can experience infertility, but women in a relationship with a man are often perceived to suffer from infertility. So, suppose a couple is unable to conceive for 1 year, 2 year, 3 years, or all. Sometimes, according to the social society we are staying in, it will be a pressure on the women itself that you are not unable to conceive. It's not that it might be the man's fault as well. No. So regardless whether they are infertile or not, infertility, it will be pressurized on the women itself. So infertility has a significant negative social impact on the lives of infertile couples, and particularly women who frequently experience violence, divorce, social stigma, emotional stress, depression, anxiety, and low self esteem because they have not conceived a child, because they have not given birth to a daughter or a son. They will be undergoing constant social stigma. So they are under social pressure and emotional stress, depression as well. So this is addressing your infertility is very important for maintaining a we can say that standard of physical and mental health, as we are we are human beings and we should attain a highest attainable standard of physical and mental health. So now let us just discuss with, so what is assisted reproductive techniques? We will be discussing regarding this assisted reproductive techniques in details in the next episode. So for that you need to subscribe to my channel so that whenever tomorrow I am posting the lesson, you will get a pop-up and you will complete this full topic of reproductive health from the first two lessons which I have posted earlier. This one, that is an introduction to infertility, and the next part where I'll be discussing all the techniques like in vitro fertilization, GIFT, ZIFT, artificial insemination, and all in details with detailed diagram. So let's just do the basics today. So assisted reproductive techniques, they include all the fertility treatments in which the earlier eggs and embryos are handled. Then that assisted reproductive technology procedures involve surgically removing the eggs from the women's ovary, combining them with the sperm in laboratory, and returning them into the woman's body or donating them to another woman. So either if it is a surrogate mother, so it can be transferred into the womb of that person, or in this if they are returning to the woman's body itself, so then it will be returned to the women's body through laparoscopic techniques, right? So they do not include the treatments in which the sperm only is handled. So they include the part where both the sperm and the ovum is handled. All the procedures in which a woman takes medicine only to stimulate the egg production without the intention of having eggs retrieved. So this is all about the basics of assisted reproductive techniques. So tomorrow we will be studying the full episode. So for that you need to stay tuned to my lesson, subscribe to my channel, so whenever you are getting the pop-up, just finish the lesson off. So thanks for watching my lesson, and keep on studying and keep on subscribing my channel and sharing with your friends. Thank you.